You're watching News Talk with Julia Cosby at TIG TV. Ontario is aiming to have 65% of adults vaccinated with their first shot against COVID-19 by the end of May by boosting the number of pharmacies with vaccines and sending mobile clinics to small employers in the GTA hot zones. Peel Region has announced all residents 18 and older in the area will be able to book their COVID-19 vaccine appointment beginning on Thursday, May 6th at 8 a.m. In Peel Region, 9 areas in Brampton are among those with the highest COVID-19% positivity rates in Ontario. I'm joined with Conservative MPP Pramit Singh Sarkaria from Brampton South Riding. He's Associate Minister of Small Business and Red Tape Reduction Minister without portfolio. Thank you, Honourable Pramit Singh Sarkaria, for joining me today at TIG TV. How do you feel upon hearing the news that Peel Region residents age 18 and older will be able to book their COVID-19 vaccine appointment beginning today?
Well, I think it's great news. This is something that we've been working towards in terms of ensuring that individuals in Peel, because we've been hit hard, should be able to get their vaccines probably before others, also because of many of the hotspots that exist in Peel Region. So we actually made the change, May 3rd, to allow all hotspots in the Peel Region. So probably about 60 to 65% of the Peel Region was able to get vaccinated as of Monday. Now we've opened the entirety of the region to allow for vaccinations. This is a great step forward, and we're hoping that Ontario in general can get the first dose of their vaccines. 65% of Ontarians get their first dose of the vaccine by the end of May, which will be great.
Ontario is aiming to have 65% of adults vaccinated by their first shot against COVID-19 by the end of May by boosting the number of pharmacies with vaccines and sending mobile clinics to small employers in the GTA hot zones. Do you see this as a big development by your government?
Well, I think it's building on, we've always been limited by supply here in the province of Ontario. Had we had the supply, we could be getting into these hot zones, into these postal codes as quick as possible. And that's exactly what we want to be able to do. We're targeting hotspots. We've increased allocation to hotspots by over 50% for the month of May. Being able to, Chief Medical Officer of Health, Dr. Lowe, even ensured that we're going to have over 70% potentially vaccinated in Peel Region, just given the fact that, we've already administered 590,000 vaccines in Peel Region. We have 432,000 approximately vaccines that were given to Peel Region in May. So, there's light at the end of the tunnel, and we're really looking forward to ensuring that people get vaccinated and that we can get through this third wave.
You're also the Associate Minister of Small Business and Red Tape Reduction Minister without portfolio. Ontario's small businesses are suffering in the hands of this deadly pandemic. How is your government responding to this crisis?
Well, we know that, small businesses have endured a significant impact during this very difficult time. We put forward multiple programs, the main stake of that being the Small Business Support Grant. This is a program that we have initiated and we have put forward where over $2.5 billion in direct payments have been paid to small businesses across the province. That's over 107,000 first payments to small businesses have been processed. Over 70,000 payments for businesses have been processed as well in terms of automatic renewals. We have the 100% of your energy costs and property tax being covered as well. The Digital Main Street program exists out there to help businesses pivot digitally, $2,500 grants. And then you also have, programs from the federal government like the wage subsidy of up to 75%, and as well as the programs around rent relief of up to 90%. So there is a collective measure of support to help small businesses because we know that they have been struggling quite a bit, and we just want to make sure that they get the money into their bank accounts as quick as possible.
In the wake of the COVID crisis, which measures are you taking in terms of red tape reduction?
Yeah, one of the things that we've really been focused on here in the province is ensuring that businesses are competitive and that some of the measures that we take can help support businesses in their recovery, whether it's during the pandemic or after the pandemic. A couple of items that we've put forward is ensuring that restaurants can deliver alcohol with their takeout orders. That was something that you couldn't do before. We're ensuring that regulations allow for 24/7 deliveries to pharmacies, to grocery stores, which unfortunately before wasn't allowed. But we recognize that there is a significant need to get items into storage right now. We look at measures like reducing the costs on restaurants by implementing caps on delivery fee service companies that are impacting small business restaurants. So we're going to continue to work on ways to support businesses through regulatory modernization, because we think that that's the best way, one of the best ways to help get out of the way of small business owners and just let them do what they do best, which is create jobs and create opportunities for hardworking families across the province.
The Ontario Long-Term Care COVID-19 Commission report laid blame at the feet of the former Liberal government and Doug Ford's Progressive Conservatives, who were slow to respond in the early weeks of the pandemic. Today, Premier Ford told the legislator that he takes ultimate responsibility for the tragedies in long-term care and promises to fix the system. How would your government fix it?
Well, we've, my heart breaks for all the long-term care homes and the members that have lost their families in long-term care homes. We have spent significant money in the lead up, and during this time to ensure that long-term care homes are supported. But as the Premier said, we accept the responsibility, and we're going to do better. Just here in Brampton alone, and in the Peel region alone, we have introduced hundreds of new beds. From 2011 to 2018, only 611 long-term care beds were built in the province of Ontario. Our government alone has put forward significant investments to ensure that we increase the amount of spaces, increase the amount of buildings, and increase support for long-term care. And that's what we're going to continue to build on. We need more space. We need more beds. The city of Brampton alone is going to receive over 400, 500 beds, which had never received before. So that is one part of the solution. And we're going to continue to work with members in the long-term care industry, our stakeholders, and ensure that families are protected and our seniors who are the most vulnerable are protected as well.
I understand that you've been busy with such initiatives such as extending the expiry dates of many licenses and permits and allowing restaurants and bars to extend their licensed areas, just to name a few. Currently, all stores can only sell essential items inside unless they're doing curbside pickup. I know that there has been much debate on what is considered essential or not. Who is determining this, and why is key cutting, for example, deemed non-essential at every hardware store in Brampton, but skate sharpening is essential?
Well, the government has put forward emergency orders that are to be interpreted. We ask that businesses, when interpreting them, do seek legal advice as well when they're selling. But what we recognize as we come across this third wave, we have significant challenges with respect to not only hospital capacity, but our healthcare heroes are doing everything and anything they can. So we did need to take drastic measures across the province to ensure that we kept everybody safe. We needed to ensure that the public health measures that were put in place restricted mobility, because what we were seeing was not a lot of people that were staying at home. That's why we implemented the stay-at-home order. That is why we ensured that essential items only could be sold. But we are ensuring that people still have access to curbside delivery where certain products aren't available. Please do order ahead. But we really want people leaving their houses only for essential purposes, and I think that is something that's very necessary.
Do you think that there's certain items that you should be taking a second look at? For example, when I mentioned key cutting, a lot of people are moving. The real estate market's very hot right now, and you can't really do curbside pickup with a key, for example. Is this something that you might give a second look to?
We're always willing to look at individual cases and circumstances. I will have to get back to you on that specifically, because as you said, there are some jurisdictions that might be, or regions that might be enforcing it, might not be enforcing it. So, or interpreting it differently. So it could be just an interpretation issue. But of course, one of the things that we've always done and really wanted to push forward is on, there is no playbook for a situation like the one that we're in right now. And so, to the extent possible, we're going to continue to not only rely on the health and advice of our health officials, but also look at different ways to ensure that the measures that we take are effective, and where change needs to be made, or where we need to ensure that certain issues are being taken into consideration, we will definitely take a look at that.
Thank you very much. On to my next question. The opposition and the media are quite critical of your government's handling of the COVID-19 crisis. How would you respond to them?
Well, look, we're in unprecedented territory right now. We see ourselves in the third wave. We've seen variants of concern that have ravaged Ontario, whether it's the variant out of the UK. Now we have, variants that are coming in through our borders from other parts of the world, and we're asking for stronger measures that are being put into place to secure our borders. But, when we look at the measures that we have put in place, we have one of the hardest and longest lockdowns here in the province of Ontario. And we did that because we know it's necessary to protect the people of Ontario. We know that we need to get people vaccinated. Right now, we have vaccinations that are happening at record levels. Yesterday, we administered 140,000 doses of the COVID vaccine here in Ontario. That is a daily record. We want to continue to build on that. We know that by the end of the May, 65% of the eligible population will have had a vaccination or a vaccine. So, we are making some great progress here. We have, shut down significant parts of the economy. We have offered support to small businesses. We have invested into our healthcare system, and we'll continue to do that to ensure that we get through this third wave and that we come out of this stronger than ever before.
Now, I know when we look at places like the United States or some other provinces, they're not in lockdown. I know our cases are pretty high. How would you compare how they're dealing with everything to how Ontario is dealing with everything? Because I feel like we probably have some of the strongest restrictions in the whole country and perhaps in North America.
Yeah, that's absolutely right. We do have some of the strongest measures in place, but one of the other biggest concerns, the U.S. was able to procure and supply their vaccine much quicker to their population. We have just we are just getting the supply of our vaccine coming into our provinces. We dealt with uncertain supply. In January, if you remember, February, we had weeks and weeks of canceled Pfizer deliveries that, when we were supposed to be vaccinating everybody, we didn't have that opportunity to do so. But now that, we have finally been able to get vaccines into the province of Ontario, we're seeing us vaccinate at a much higher level. And, a lot of this could have been avoided had those vaccines been here earlier. But, we're going to continue to put forward strong public health measures and also ensure that people continue to get vaccinated. So there is a lot of light at the end of the tunnel. We just need to ensure that we keep following the public health advice and that we keep working together to ensure that we can get through this difficult period of time and enjoy a summer, hopefully, in the next couple of weeks.
9 areas in Brampton are among those with the highest COVID-19% positivity rates. How worried are you about the riding and the whole city of Brampton?
Well, we know that, Brampton is full of essential workers. That's why we started vaccinating essential workers like at Maple Leaf Farms, Amazon. We rolled out vaccination clinics there to ensure that, and every, starting Friday again, we're going to be rolling out vaccination clinics to essential workplaces, not only in Peel, Toronto, York, because we recognize how important these are not only to our economy, but also ensuring that people get the support they need, especially cities like Brampton, which have been working throughout almost all of this pandemic. So we're going to continue to do whatever we can to support cities like Brampton. We're going to be building a new hospital in the city of Brampton to ensure people get the support they need, which is, the city's been neglected for so long from a healthcare perspective. We're building a new 250-bed hospital with an ER room. We're building significant investments in long-term care. as we roll out vaccines into Brampton, we're rolling them out into the Pfizer pilot in vaccines is rolling out all across the province. Specifically in Brampton, we've got 7 pharmacies that are offering the Pfizer vaccine here in the city of Brampton, alongside 64 others that are offering the AstraZeneca. So there's lots of work being done, and we know that hotspots are what need to be focused on, and that's why we put an additional 50% of our supply into the hot zones. And we're going to do everything and anything we can to support cities like Brampton.
Are there any other ways that you're tackling this pandemic in Brampton?
Well, yeah, the most important part about tackling the pandemic in Brampton, I think, is very much so on the terms of increased vaccinations. Now that we have 50%, almost every postal code, as you mentioned, in Brampton is a hotspot. So we're receiving 50% more of the entire supply. So the 20% of the province's allocation is going to Peel, and of that allocation at Peel, a significant portion of that is going to Brampton, because every postal code in Brampton is a hotspot. So we need to continue to vaccinate. We need to continue to increase testing at our hospitals, at our, ensuring that essential workers are getting vaccinated. We're running through programs on that as well. I think by targeting essential workplaces, as we mentioned, starting tomorrow again, mobile vaccine units in factories, in essential workplaces, that is also going to be a key part of our plan to get people vaccinated and get cities like Brampton back up and running again.
Now, do you have any closing comments to the residents of your riding and Ontario to combat the ongoing pandemic?
In closing, what I really do want to stress is I just appreciate everybody that has sacrificed so much during this time. I really want to urge everyone to get the first vaccine available. Get out there, get your vaccines. It's about keeping our communities safe. It's about keeping our families safe. And it's so we can get back to a sense of normalcy very soon in a short period of time. So my urge and request to all residents is to ensure that they get vaccinated. Is that they can go on the provincial website to book any age group over 18. Anybody over the age of 18, and all of Peel region, whether it's Caledon, Brampton, Mississauga, can now apply to take an appointment. So, we urge everybody to do that, and we really appreciate the opportunity to continue to serve our residents, and happy to continue fighting for our city at Queen's Park. So thank you so much for having me.
Well, thank you so much, Honourable MPP Sarkaria. We really appreciate your time. I know it's very limited. Thank you for joining me today on TAG TV. You are watching News Talk with Julia Cosby at the International News Channel of TAG TV today.